from India. He's the managing director and a consultant urologist at Preeti Hospital in India. Uh, in the last few years, Dr. Mohan has become a celebrity in the field of urology, and he has conducted over 300 webinars and performed hundreds of live surgeries. Dr. Chandra Mohan
Yes.
will present a topic about comparing thulium versus holmium lasers for stone surgery. Dr. Chandra Mohan, can you hear us?
Yeah. Am I audible?
Yes, can hear you.
Yeah, first of all, I thank the UMERGE organization for taking initiative for this lasers, which is very important in the present era in endourology. So I will be restricting my talk on stone management, the role of the lasers, particularly holmium laser and thulium fiber laser. So I will share my screen uh, and I will try to finish my talk within stipulated time of 15 to 20 minutes. And so this is my presentation. I will go to the first slide. Thank you once again. So am I visible my slides? Hello?
Yes, we can hear you.
Yeah, thank you.
And it's clear, yes. Thank you.
Yeah. So first is thulium fiber laser versus holmium laser. Myself as introduced by him, Dr.V. Chandra Mohan from southern part of India, Hyderabad. And it depends on various factors how these two. Already we are listening since morning. Various properties are utilized in various situations. No rules and regulations. Your expertise, literature matters a lot. Most important is according to the clinical situation you have to change. To be honest, I am not supporting thulium fiber laser. I am discussing both options. For last 3 decades, holmium laser has ruled, and because of its various advantages. It can help in enucleation, it can help in lithotripsy. We have 20 watts, we have 60 watts, we have 100 watts. But most of the literature says you use only 20 watts. It is versatile, and thulium fiber laser has come with more advantages. You all have seen this slide 100 times. It is one lamp of 20 watts. It carries weight. It is big. You can multiply only the lamps, but not the uh, uh, one one lamp. You have to put lamps in the order and unite them. That's why the size is bigger. As the science is evolving, all these sizes are decreasing. Port size, laser sizes, scope sizes decreasing. This is the first point. But still, 200 micron fiber is the commonest laser fiber used worldwide for stone disease. Reason being, 20 watts is sufficient. It fragments very well, and the energy used is properly utilized, and it does not have much coagulation effect. That's why it succeeded for 2-3 decades. But the problem is to make the fragments small, it takes time in RIRS, not in PCNL. The high power is required in the theater, lot of sound will come. It is bulky, it is sensitive because of mirrors, you can't shift it. The laser fiber cannot be decreased below 200 micron because of its property itself. The pulse frequency of individual cavities is limited to less than 30 Hz. That means frequency cannot go more than 80 usually. In 20 watts, you cannot go more than 15. 15 Hz is very low when you want to make popcorn technique. That is where first time thulium fiber laser has taken lead. Frequency. But is it required? Now argument is it required? Is that frequency required for stone? Let us see. The next generation came with high frequency. They claim that you can make fine dust in a no time. A large stone you can do fast fragments and fast dusting because of high frequency. Few complication I cannot comment. It has its own problems. Better fragmentation in the lower pole I cannot comment. It is individual. It depends on the calyx, it depends on the size, it depends on the impaction. Small laser fiber, yes, 150 micron is possible. It is used already by me. 50 micron laser fiber also will come. Less retropulsion, again individual experience. I feel in ureter, no laser. As somebody morning told, no laser in ureter. If possible, push back and use laser. If possible, pneumatic. So no conclusion on that. Smaller fiber, good. Reason being, the laser is used efficiently on the tip of the stone. Number two, more useful is in 3.6 French channel, the water flow will be better if you use smaller laser fiber. The answer is over. Smaller the laser fiber, future 6 French, 5 French ureteroscopes can come. As simple as it. High frequency, this is the only thing which I like in thulium fiber laser with my experience. The important point is when the stone is very small, it is big headache to remove those 1,10,000 fragments. You wanted to make ultimately dust. Somehow in RIRS, stones are formed in fragments at the end. These small fragments, whoever makes dust faster will succeed in limited time. That time you need low energy, high frequency. You don't need high energy to make small pieces into dust. What is that low energy? 0.1 joules. Is it available with Holmium? No. Then frequency 15 is maximum with 20 watts. If you use 100 frequency, is it safe or not? Safe. You don't require 2000 given by the mission. You require only 100 frequency, 200 maximum. Can it be done with Holmium? No. That means if you want to make small fragments into powder, 100 people will go inside and make these 1000 fragments into 1 lakh powder in 1 minute time. That's all the entire presentation. When you want to make powder in PCNL, you don't make powder, you make pieces. So no role of thulium fiber laser if you talk logically. In URSL, no role. You don't require dusting in URSL. First of all, no laser. Only in RIRS, only when the stone pieces are small, only when you want to make dust, TFL is useful. I hope I am very clear. No conflicts of interest. The high frequency, low energy, what is that? 100 to 200 Hz, 0.1 to 0.2 joules will make it powder in no time. So this 300 to 500 is not needed. These qualities make it stand. This slide everybody has seen. It is electrically generated, passed through the thulium doped ions and ultimately give the thermal energy only. Both are photothermal. All the talk we are doing today, lasers, is photothermal, air bubbles, collapse of the air bubbles and destruction of the stone. No other mechanism. This slide many people have shown. There is no point wasting time. Only Holmium and thulium are useful for both stone and prostate. That's why after 4 decades, only these 2 lasers are fighting. No other laser stood, because you can't buy one laser for stone, other laser for the prostate. No, one is continuous, another is pulsatile. But thulium fiber laser is versatility is electrically you can change the pulsatile nature versus continuous nature. That's where it is good. A beam is focused. You are focused. You go on to the stone, no lateral spread. The Energy efficiency means the amount of the current used is very less. Less energy consumption overall. Easy installation, small box thulium fiber laser you can hold and take into your car. 10 times lower energy. We are talking about lower energy. 10 times. 1 watt if you use, here zero point 0.1 watts you can use. That is sufficient to produce the small stones into powder. So these are the settings. Everybody junior will ask what are the settings of TFL. Dusting 0.1 and 100 Hz. 0.1 is very low energy. You cannot damage the kidney. Fragmentation is 1 joule 10 Hz, my favorite setting. 1 joule 6 Hz, my favorite setting. Popcorn at the end you have to use unless you use suction which has come recent 6 months. When suction was not there, better to make fine powder, leave it. By 48 hours it will wash off in the urine. In that case 0.025 and 240 Hz, very good setting which is not possible with the Holmium. Clinical application, you see both. On the left side the vision is less but powder is fast. Why? Because if you are using high frequency, vision will not be there. That's why people like Oliver Traxler says more than 200 Hz you cannot use because you don't see anything. You have to stop on. But the rate of powder formation is very fast. Left powder is the thulium fiber laser. Right also can become powder, but you have to spend another 5-10 minutes extra time. There is no difference. Holmium can do very good job, but you need to spend another 5 minutes popcorn for these small fragments to become powder. In the ureter, you should not use as much, but if you use thulium fiber laser, you have to use very low energy, very low frequency in the center, make pieces, remove. Everybody says thulium fiber laser cannot be used in ureter. No, you have to understand the property. Low energy, low frequency, 6 Hz, no lateral spread, no thermal spread. Stop and do it. Make fragments like pneumatic, you will be successful. In PCNL, laser usage is controversial, but lot of the world shifting towards laser. Pneumatic is very good. Migration is the only problem. If you want to use laser, large fiber is required. You have to use high energy, break it, remove it. Then there is no difference between Holmium and thulium. Holmium in fact scores a little more. Ultra mini PCNL same, because 500 micron fiber can go in smallest nephroscope. That means you can use high energy, make pieces, take out. But lot of the surgeons nowadays are using powder dusting technique in PCNL. No use. Why you want to make powder in PCNL? Make pieces, remove them. No logic in making powder in PCNL. PCNL is a surgery where you have sheath to get the fragments out. Then why you wanted to do powder? If you wanted to do powder, you can do RIRS as well. Then ablation efficiency. For example, you are doing 2 centimeter stone, 3 centimeter stone in RIRS. You are crazy. You have put stent. It is accessible. What is the time taken by the thulium fiber laser is only 10 to 15 minutes. Whereas Holmium will take little more time because of the popcorn. So whatever 20 minutes, 10 minutes talk you give, only difference is low energy, high frequency thulium fiber laser is useful to make the fine fragments into powder. That is the only advantage. If you don't want to take that advantage, TFL is of no use. But we are all going towards RIRS for less than 2 centimeter stone. In those cases, making powder is very good unless you apply suction. Efficiency means more the fragments are there, more faster it causes powder. Same energy settings. 100 frequency is sufficient for 1 lakh pieces. Give 1 lakh pieces, don't give 1000 pieces. If you have 1 lakh pieces, it works better because 100 people will continuously bombarding those fragments. That means larger the stone volume, better with thulium fiber laser. Smaller the stone volume, no difference in RIRS. If you have 1 centimeter stone, thulium and holmium, no difference. If you have 2.5 centimeter stone, yes, thulium fiber laser a slight advantage. Ablation rate is faster, ablation efficiency is better, and there are a lot of studies have already proven CE approved, FDA approved. Retropulsion, I don't want to comment, both causes retropulsion because TFL has low energy setting, retropulsion is less. TFL is a long duration pulse by nature. You need not get settings, whereas holmium long pulse and short pulse are different. Thulium fiber laser per se is a long pulse. That means it won't hit suddenly. It will slowly, longly hit. So the stone will be there, there itself. So retropulsion will be less, even by nature without any settings. Laser fiber I have seen it will not damage because there is no blast sheet in thulium fiber laser. Maintenance cost is good, and if you use very high energy, laser will burn very fast. You can clearly see fast burning will be there, but damage will not happen. That is what my experience and literature also says. Future 50 micron laser fiber is possible, but not possible with holmium. But how far it is useful, we don't know. If the small flexible scope comes in the future, small channel comes, this 50 micron fiber is useful. Any stone, holmium or thulium, it will break. Stone composition is not very important. Fiber burn back is very low with thulium fiber laser if you use 30 watts, 0.2 mm. For one case, you don't even recognize whether it is burning it off or not. So, but you should not talk only advantages. There are two disadvantages: carbonization, temperature. Worldwide literature says that it is safe, but I feel when you use high energy, high frequency for a long time, water becomes hot. You can feel with your, forget about the studies, you can feel with your hand over the gloves temperature will rise. So you should not continuously use high energy, high frequency. What is that? Papers say 25 to 30 watts is the last. Whatever the combination, 25 to 30 watts, don't go more than that in the kidney. Then temperature is not a problem. In the ureter, if you touch the ureter, TFL causes coagulation, holmium causes cutting effect. So definitely thulium fiber laser is dangerous as far as the temperature is concerned. So don't touch the closed walls, impacted stones. Thulium fiber laser is not good. Thulium fiber laser is not good in impacted stone, even in infundibulum. Nothing will happen. It causes fibrosis. In the ureter, we cannot afford that. So be careful. Use low energy, low frequency. What is low energy? Less than 1 watt. What is low frequency? 10 Hz. 110, remember, don't cross that line. You will be very safe. So sparks will come. You see on the right side, on the left side, the sparks and carbonization. Whenever you put more than 2 joule, blackening of the stone happens. The sparks will come. Scope will not damage, but the surgeon who is doing feels very uncomfortable. You have to stop it and then start, stop it and start. That means fragmentation. Maybe holmium laser is better in PCNL. That's why holmium is doing very well in the private practice. The stone gets fragmented easily without carbonization. So PCNL fragmentation very good. Holmium laser. Only in dusting in RIRS, popcorn technique, thulium fiber. Impacted stone disease. So these are the cases you should be very careful. I wish everybody should use pneumatic lithotripter, break it, push into the kidney, do whatever you want. If you cannot break with pneumatic lithotripter, somebody told laparoscopy, antegrade PCNL, open also good, but don't damage the upper ureter. Once you damage the upper ureter, it is equal to nephrectomy. Repair of the upper ureter severe stricture is very difficult. Very few people can do buccal mucosa, very few people can do the Montes flap. For all the juniors, do not use laser casually in the upper ureter, especially in spinal anesthesia, because when that patient is taking respiration, you will touch the mucosa. That's not good. So I am showing here a different story. 2 years baby, you are passing a suction with thulium fiber laser. You are sucking out the fragments. In that case, thulium fiber laser and holmium laser, no difference. Till now we said powder. Now last 6 months, people are saying you go inside and see the big stone like this, see beautiful stone with accesses in the kidney in a 2 years girl. Now you make fragments, don't powder. Very fast powder or fragments, all the fragment you suck it out. See, it is getting powdered now. At the end they will get fragments. See, these are the fragments. They are coming out through the sheath. Then there is no difference between TFL and the holmium. So technology will keep on changing. You observe, you take the literature, the entire 2 years baby, within 2 minutes, you see entire kidney is no stone, no powder, nothing. You contrast, no leak. And if you inspect the kidney, in the, see, you see in the right side, completely free of any fragment. Next day, if you do CT, you will not see any stone. Similarly, this is a pediatric PCNL, 8 years boy. Let us compare. This is the last slide. Holmium versus thulium versus pneumatic. I will show honestly, thulium fiber laser, when you are using, it produces less vision, it produces carbonization. This is a supine PCNL. Whatever may be the PCNL, you will use a smaller scope here. And once you pass the guide wire, this is not the important here. This is the thulium fiber laser. You observe carefully, the fragmentation is not that great vision. Some amount of turbulence and bubbles will come. Now I will change over to holmium laser. See carbonization, making holes in this thing. It is making powder fragments, but see so many air bubbles will come and they disturb. Now I switched over to holmium. Same case, same child, same. Now no carbonization, same laser settings. So what I am arguing, please use holmium in PCNL, no problem. Only for, see how it is nicely fragmenting. By chance, if you use the pneumatic, what will happen? Is a small child. Now I will change to pneumatic. This is fragmentation, nice fragmentation, no change in vision. This is holmium. Now I am using pneumatic. In one hit, it has gone into upper calyx. In 2 hits, it is made into 4 fragments. In 3 hits, all the stone is broken into small pieces. They are out. So in the same case, the thulium fiber laser is causing less vision. Holmium fiber laser, nice fragmentation. The pneumatic lithotripter has pushed the kidney into upper pole, stone into upper pole, but very fast pieces. So you have to use your own knowledge according to the case, whether which is good, which is bad. To conclude, yes, as of now, thulium fiber laser overcomes some of the limitations, not the main limitation. Sorry for that. Some of the limitations. Take home message is, future small fibers may come. Pulse energy is very low. Super high pulse station up to 200 is sufficient. Have some advantages, but not complete. So if the suction is used in the future, that advantage also may not be there. So I thank for giving this opportunity. I hope I have given the latest information with my clinical experience of 17 years in lasers and stone surgery. Thank you very much.
Thank you, Dr. Chandra Mohan. So, dear doctors, do you have any questions? First, we start with Dr. Rawa.
Dr. Rawab, happy talking to you. Thank you very much, dear Dr. Chandra Mohan, for joining us. Actually, I don't have question, but I have rather appreciation and thanks what you are doing through your demonstrations, live surgeries, educational videos. You are simply doing a great job.
Thank you, sir.
Sorry,
You
Joe,
become a
can
mentor
you-
for free for a good number of urologists across the world. Please keep it up. Once more, thank you very much.
Thank you very much, sir.
Hello?
Hello.
I don't know if my sound is clear. We are virtually participating in the meeting.
Yes, your voice is clear, Dr. Makro.
Yeah, thank you. Thank you. I'm Dr. Al-Garshwani from Erbil, Iraq. Thank you so much, dear Dr. Chandra Mohan. We meet each other in Delhi last year. It was a great honor for me to see you there. And really, you do a fantastic job, especially in pediatric stone lithotripsy. Really, my question to you is about what's the future of the ureter with this dilatation and use this large ureteric access sheath. What I see, especially the bendable one that nowadays you are working on it.
Yeah.
It has a large size, I think 12 or even 14.
Yeah.
I hope that we hear some points about the future of this type of sheath. Either could be increased risk of ureteric stricture, especially in small children.
It is a very good question. To be honest, as of now today, last 6 months I am using access sheath bendable only in pre-stented patients, whether adult or child. I fear a lot when I am using more than 10 French. Honestly, experience is not the matter, it is your wisdom. Don't use more than 10 French access sheath casually. Ureter may not accommodate. Please put stent and do the experiment. As of now, ureter is accommodable, very good for 9 French only. If you are crossing more than 10 French, you are going back to 4 decades back. Ureteroscope now we are using is 6 by 7.5. Previously, all the seniors used to do with 12 French. They struggled because they don't have availability. Once you have availability, going back again 12 French is not good, not good, not good.
Thank you. It's a clear message. Thank you.
Any more questions for Dr. Chandra Mohan? Thank you.
Thank you very much.